The family of a young girl from Ontario says the eye drops needed to keep her from going blind are about to become unaffordable. Take a look. This is 9-year-old Erin Little. She takes eye drops several times a day for an ultra-rare disorder. Right now, they cost the Little family a few $1,000s a year. But Canada has approved a plan to sell the official version of the drug, and the price tag, more than $100,000. Joining us from Port Elgin, Ontario, is Erin Little. She's Olivia's mom. So let's start with this. Explain this situation. Why are the drugs going up in price so much?
Good morning. That's a great question. I don't know why they're going up so much. It's a new product approved by Health Canada. And with it being a new drug, it's just coming up in with a really big sticker price. So we are just left without information as to why it is so much more.
Now, explain to viewers why your daughter needs these drugs.
Okay, so Livy has the ultra-rare disease cystinosis, and it's a genetic disease. She was born this way, and she was diagnosed when she was 18 months old. And so the amino acid cysteine can't release from her cells. So the cysteine builds up, and the cells die off, and it crystallizes, and those crystals attack her kidneys and her eyes first. It's kind of the two places in the body it just shows up. And she takes an oral form of cysteamine called Cystagon, and she takes that every 6 hours. And that takes care of her in body. And it doesn't cure it. It's not a cure, it's just treatment. So it just slows the progression of the disease over time. Mm-hmm. And then to treat the cornea cystinosis, she's had to have drops hourly since she was diagnosed at 18 months old. So for the past 8 years, that has been her treatment to keep the crystals out of her eyes. And because of our diligence, and all of our doctors would agree with us, and they've seen the images of her eyes, that she goes to no crystals. So we are preventing the damage from happening, which is what a treatment is supposed to do. So the disease is very time demanding and requires a lot of effort on our part as our parents to take care of her.
And it's those eye drops that you need to get for the preventative measures that the price is going to more than $100,000 a year?
Yeah, so the eye drops are extremely preventable from a preventable measure, and it decreases the damage that's done. And you know, there are eyes, and how grateful are you that you get to open yours every day and they're not itchy, they're not sore, that a simple light in your room doesn't affect your ability to see. Imagine it, you know, summertime. As Canadians, we love summertime. And going outside, and you know, these kids that don't have drops or take drops, they are severely affected by going outside in the bright light. It's almost blinding to some kids. They can still see, but it just hurts their eyes so bad. And a lot of these kids have to wear sunglasses all the time, and it's hard. Like it's a hard disease because the compliance is so intense. And if you know anything about treating a disease, if you have to take a lot of medication, it's really hard for people to manage.
So right now, how much are those eye drops, and where do you get them?
So the drops she's currently taking. Mm-hmm. Yeah, so the drops she's currently taking, she has, we've always gotten them from our pharmacy, used to compound them, and then up until the end of 2018, they outsourced them to a compounding pharmacy in Quebec. And so we have been on those since diagnosis, not from Quebec, but for the past year. And those drops run at $24 and change a week that she has been on. And there is provincial cover in Ontario. It has been covered, so we haven't been paying those out of pocket. And so that's what she's been on, and that's what's kept her in such great care.
When will that run out?
So on Saturday, so tomorrow, we open our last bottle, and they will last us until September 14th. So we have 2 weeks left of her eye drops, and we're just and we'll see where we go from there.
I'm so sorry.
That's okay.
Yeah, I can't imagine just how you're feeling about this. So it's only going to last for a little bit longer. What do you think you can do after that?
Well, everybody keeps asking what the plan is, and you really don't plan. You don't come up. There's no 5-year plan when your kid has a disease. You kind of go day by day, and this is, kind of manifested into the plan, and hopefully the attention. If something happens with the process, and hopefully they work harder at getting the new drug, because that's our only option. Because when Health Canada approves a new drug, other companies have to stop making compounds and selling stuff that's not Canadian approved, and that has nothing to do with the pharmaceutical company. It's a Health Canada rule, and that is one of the things that we as a family feels that has to change. Because this is our second time within 2 years running into the same problem, and it's all has to do with the process and how drugs are approved in Canada, and that's the problem, as well as these high sticker prices that they put on rare diseases.
What about insurance? Does that help you at all?
No, not yet. So our insurance still is undecided if they're going to cover the drugs.
What's your message to Health Canada then?
That. Why they're prioritizing profits and the process that they go through, the patients are the ones that suffer. And it has to change, and we have to start putting patients first and thinking about them. It's change the process. Until a drug has funding passed and a sticker price is on them, we have to make sure that there's a plan for those patients so they don't fall through the cracks again. And we need to question why these drugs are so outrageously expensive. And the thing is that my number one thing is that I sat in a room once and I heard Olivia referred to as what she would cost to keep alive until her expected age of 27. And I think the thing that needs to be recognized is that the patients aren't going to bankrupt our country, that the pharmaceutical companies are going to bankrupt. And there's a difference.
Erin Little, thank you so much for sharing this story with us. We are going to be thinking of you and Olivia, and we hope it all works out.
Well, thank you so much, Hannah.
Thank you, Erin. Erin Little is in Port Elgin, Ontario.